Good afternoon, everyone. I am Julie Hoffman, and I'm Chair of Advocacy for American Diabetes Association, Desert Southwest, and I have the honor and pleasure of co-chairing the Voice of the Patient with one of the board members from AZBio under Joan, and we've done this together for a number of years, and I am so happy to be here. Tucson has a special place in my heart. I was a student worker at the College of Medicine bookstore in undergrad. And at that time, I was also a caregiver. I grew up being a caregiver. And then once I had a baby girl, I'm still now an adult, continued to be a caregiver. Back in 1997, my little 1.5-year-old daughter, Taylor, was diagnosed with type 1 diabetes. Some of you in this room may know Dr. Mark Wheeler, pediatric endocrinologist, and I know he's a professor emeritus here at U of A. Diagnosed Taylor. The only person that I knew with type 1 played softball here, back-to-back champion Lady Wildcat teams back in 96 and 97. Her name was Julie Wrightan. She passed away. I was with her the night before she passed away at a wedding rehearsal dinner. And the wedding the next day then turned into a prayer for her. It was very solemn, and I couldn't believe that this young person I had just been with hours before passed away from hypoglycemia. Fast forward 6 months, and my baby girl received the same diagnosis. And I worked for the Postal Service on Rosemont. And I will never forget getting that call from my husband. And he said, "You're not going to believe this." So immediately my mind went to what could happen. This must be the worst thing. There's no time when someone's diagnosed with type 1 diabetes to feel sorry for yourself. We had to jump into education, learning how to give micro doses, which is really popular now with GLP-1s, right? Micro doses of insulin with the caveat that, that be careful, because if you give too much, your daughter could have a terrible outcome. And she did have some seizures. But thinking about, as we were coming down to Tucson today and drive down Speedway, and got tears in my eyes seeing Catalina United Methodist Church that has a little toddler program, a preschool program. They allowed me to come in and give this baby girl in their program little doses of insulin on my lunch hour. We got doctor's notes and did everything, and as she grew, we realized that navigating diabetes as a student, as a mom of a student, was going to be very difficult. We also learned something that some of the professionals in this room, and certainly patients, may know, something called non-medical switching. When you are prescribed a medication, you go to the pharmacy counter to get that, and lo and behold, your product is no longer covered, but there's a substitute, usually a brand name. And I learned all about PBMs and formularies, and at that time, pre-existing conditions. And so as a caregiver, it was terrifying to know I can't leave my job, she won't have insurance, what am I going to do? We finally moved to Phoenix, where we had some family, and she became very, very ill. She was misdiagnosed, thank God, misdiagnosed with cystic fibrosis, and for about 6 months we lived believing in that diagnosis, and it was actually undiagnosed very severe celiac disease. So that was very easy to fix, just a gluten-free diet. Fast forward through her time at school, And I have to give so much credit to the American Diabetes Association, as all of our advocacy organizations. I know Debony here with ALS. The resources that these organizations offer the community, families, caregivers, the patients, it's fantastic, and I would encourage anyone here to at least, if you don't participate locally, look at the headquarters web pages and try to find some of the latest research and the ways that those innovations are affecting patient outcomes today. My daughter became a excellent softball player. She was the state champion in 3-position small bore rifle at Ben Avery Shooting Range with her insulin pump in her pocket. She was a student intern at a pediatric endocrinology office, and I'm a little embarrassed, but I know I'm amongst friends to say that one of the things that happened during that time she spent as an intern is we had health insurance coverage challenges. That doctor sustained us through a year and a half of supplementing our meager coverage with free insulin samples that kept her alive, that got her into ASU with a scholarship. We worked with the Disability Resource Center to, and I certainly used my advocacy experience to work with some of the other students that had type 1 and to get accommodations, testing accommodations, housing accommodations. And I know U of A has had a SALT program here, and I don't know what it's called now, but back when I was here, it was the SALT program. But amazing work that is done for patients, and I want to say thank you for everything that you've done. Those accommodations through the DRC allowed her to take the MCAT, and also her own hard work, of course, and then matriculate into the U of A College of Medicine Phoenix through Pathway Scholar Program, which I know that Tucson has one too. She got her MS in that and is part of the class of 2026 and will be graduating next month with an MD, and will be doing a 4-year psychiatry residency here at the College of Medicine Tucson. I'm very proud of her, but one thing that I do want to talk about before our time is over today is that coverage does not equal care. And I think most people in this room, if you have not personally experienced that, someone you know has. At the Capitol, I have been down there since just less than 2 months after she was diagnosed, and I haven't left since. We fight for coverage. I don't necessarily like the word fight, but that's really what it is. There is opposition at every step along the way. Tech, devices, innovations often aren't covered. Again, I know Joan's a fighter like me. We're down there negotiating, strategizing. How can we get these things covered for our adult children and the next generations of youth that follow? And the last thing that I want to talk about that has greatly affected not just my personal mother-daughter relationship with Taylor, but many of the relationships that I've developed over the years with other advocates, caregivers, and patients. And that's the mental health burden in chronic disease and other diagnoses. Our mental health screening consisted of, and I'm not being silly, this is the truth, a little tap on the arm by the doctor. How you doing, kid? Mom, you good? You good, Mom? Great. That was probably 98% of our mental health screenings were something like that for almost, 28 plus years. If there's one thing that I know that our universities can work with advocates and other professionals in the life sciences that bring patients and advocates together, it's to work on that. How can we better support each other? How can we use all of this knowledge that's researched and studied to actually talk to patients and caregivers where they're at? And I'll close with this. When I first went to the legislature almost 30 years ago, insulin was not covered. I panicked. I experienced that non-medical switching. And in 1998, 8 months pregnant with my second daughter and with this little tiny tyke on my hip, we worked on a bill that finally, state law, that insulin, blood glucose test strips, and a few other things are mandated coverage in this state. Fast forward 28 years, that statute still stands, but we have not been successful in expanding the terminology of that statute to include innovations, technology. I have been assured by the insurance companies that next year will be the year. They have promised me through many stakeholder meetings that they will not oppose. But I just want to leave you with that there's always, always something to work on. And I could not be more grateful for the opportunity to talk to you today. So thank you.